Good morning, everybody. Thanks for all the participants for joining us for the short webinar today on first aid. We'll just go through the slides. We'll just try to sort out these medical emergencies, basic medical emergencies which happen to people around us, to our relatives, to friends, and how are we going to just help them in that time of crisis, and how do we make them comfortable enough to reach the hospital or call the people from the hospital to them. So as we know, the that the nowadays heart attack has become very common. People around us have lots of chest pain, and they end up having a severe heart attack, which is very fatal. So to understand what are the symptoms of a heart attack, how does it happen, and why does it happen, and how are we going to help them when they are in need? To understand that first, I would like to, with this diagram in the picture, I would like to make you understand that a heart, as any other organ, is supplied by the blood vessels, that the arteries, which give nutrition to the heart muscles to pump blood. If any part of the heart does not get this blood supply, it just doesn't work. So that part of the heart just starts to die, and that is called a heart attack. So out of the three arteries, it might be one artery, it might be part of the artery, it might be the whole artery which has got blocked, or it might be more than one arteries. So what are the symptoms of this heart attack? Maybe I can just show you a little video. The output, the picture would not be too well, but I'll explain you at a later stage. So just go through this video.
A heart attack can strike at any time and place. The first symptom that manifests during a heart attack is a feeling of breathlessness and discomfort. One might also feel sudden pain in the chest, upper abdomen, upper back, shoulders, jaw, etc. Increased sweating can be noticed, and in some cases there may be nausea too. Prominent signs of a heart attack are breathlessness and anxiety, chest pain, sweating and palpitations, nausea. When you notice someone experiencing a heart attack, call out for help immediately. Call an emergency helpline equipped to deal with heart attacks. Assess the victim for a response and look for breathing. If there is no response and no breathing or only gasping, check for pulse. If you do not feel a pulse within 10 seconds, perform 5 cycles of CPR. Lack of blood supply to the heart muscles causes a heart attack. Time is critical in such a situation. All types of chest pain need evaluation in a hospital capable of managing heart attacks. Symptoms of a heart attack. Prominent signs of a heart attack are breathlessness and anxiety, chest pain, sweating and palpitations, nausea. Call an emergency helpline equipped to deal with heart attacks immediately. Time is critical in such a situation. Effective treatment instituted within 1 hour can lead to complete reversal of the damage suffered. Help the patient sit down and remain calm. Make sure that the patient continues breathing and has a pulse till the ambulance arrives. If there is no breathing or pulse, perform CPR.
So as you saw the video, the signs and symptoms. So there would be a chest pain, there would be breathlessness, there would be uneasiness. It might be possible that the patient will tell you some vague symptoms like they are having some type of uneasiness, their heartbeat is very fast and they feel that the heart is throbbing a lot. But the mainstay of this whole thing is, number one, pain. Pain in the chest, pain in the hands, pain in the neck, pain in the jaws, pain in the abdomen. Any such pain associated with breathing difficulty, sweating, uneasiness, unexplained heart throbbing should be checked out for heart attack. Our heart lies in the center of the chest. It is not on the left side as many people try to understand. It is the center of the chest with innervations all around. So it might be possible that the pain is referred only to the left hand, only to the jaws, only to the neck, only to the abdomen, and we miss it out. So any pain, the chest pain, the pain in the left hand, the pain in the jaws, the pain in the neck, the pain in the abdomen, all needs to be checked for heart attack. Secondly, as I told you, if there is a blockage in any of these three arteries, the area of the heart which is supplied by these arteries or the part of these arteries starts to die. So time is critical. Time is critical to open up that artery as soon as possible. There are many methods to do that. There is medications to do that. There are interventions to do it. But for this, you should be able to recognize the heart attack, number one. And number two, take the patient to the hospital for further treatment. The people who are at high risk for this heart attack, these are people who have high blood pressure, that is hypertension. They are on medications for hypertension. They are people who smoke, means smokers. The people who have diabetes, the people who have sedentary lifestyle, the as lack of exercise, people who are overweight, people who have high blood cholesterol levels. These all are interlinked and these are all high risk factors. If a person has all this, the chance of having a heart attack is more than a normal person. So as you saw in the video, what do? We try to calm down the patient, make him sit up, loosen his tight clothing, try to talk to him about medications, what he's taking. If we feel that yes, he is an emergency, we call the helpline number, we call the hospital and try to take him to a hospital for further help. If you have at home, if you have sorbitrate, you must be acquainted with sorbitrate. Sorbitrate is a small tablet which needs to be put under the tongue, that is sublingual. It's basically a nitroglycerin and it tries to reduce the pain. How does it help? This is basically a vasodilator in technical forms. I'll tell you in simple form. It is basically a medicine which tries to relax the arteries. So by relaxing the arteries, the artery which has got blocked might just get a little loosened up and the blood flow restored. And in doing so, the chest pain decreases. It can be taken every 5 to 10 minutes under the tongue till you reach the hospital. Next, a very common thing is something called stroke. What is stroke? Stroke is the same thing, but not in the heart, but in the brain. Stroke are of two types. One is called a ischemic stroke and the other one is called a hemorrhagic stroke. What's the difference? Ischemic stroke is that the artery which supplies a particular part of the brain gets blocked, as you saw it in the heart attack. And hence that part of the area of the brain starts to just die down due to lack of oxygen, lack of nutrition. The other one is the hemorrhagic stroke. Hemorrhagic stroke means The artery which supplies to a particular part of the brain just ruptures in between due to some malformation or some high blood pressure. It just ruptures and blood oozes out from the arteries. It gets collected near that point and it increases the pressure all around itself, thus pressing the brain and lowering the circulation, in which again the brain functions hamper. So what are the symptoms? The symptoms are like this. He will have difficulty in speech, difficulty in speaking, loss of vision might be there, confusion might be there, loss of movement of control or balance can be there, and sometimes he can even become unresponsive. It just depends on how bad or how complicated has this stroke been. The easiest way to find whether a person has suffered a stroke is a word called FAST. Word called FAST. F is face. So if you see that there is any type of abnormality on the face has become asymmetrical, there is a facial droop on one side, the angle of the mouth seems to be deviated. You see that one of the arm he's not being able to keep his arm at one position. So the arm is drifting from one side to another. The speech is become slurred, or the speech has become affected. He's not able to speak out clearly. If you find any of these symptoms, the chances of a stroke is very high. It is that he might be having a stroke. He needs to be taken to a hospital as soon as possible, because it needs to be found out what type of stroke is he having. Please, these patients should not be given any type of blood thinners, because until and unless it is found out what type of stroke is it is very harmful for giving blood thinners. Blood thinners will further make the blood thin, and the arteries can just burst out, leading to hemorrhagic strokes. We'll just show you the video now. Just go through the video.
Facial droop. One side of the face does not move as well as the other side. Arm drift. One arm does not move, or it drifts when compared with the other.
Find out whether any pricing can be fixed correctly, so that we are sure about what we are doing.
Abnormal speech. Patient slurs words, uses wrong words, or is unable to speak.
So is everything alright with you, sir?
If any one of these symptoms is detected, the probability of a stroke is 72%. If all three symptoms are found, the probability of a stroke is more than 85%. Risk factors for stroke include having high blood pressure, having had a previous stroke, smoking, having diabetes, and having heart disease. Your risk of stroke increases as you age. Seek immediate medical assistance. A stroke is a true emergency. The sooner treatment is given, the more likely it is that damage can be minimized. Every moment counts. In the event of a possible stroke, use FAST to help remember warning signs. Face. Does the face droop on one side trying to smile? Arms. Is one arm lower when trying to raise both arms? Speech. Can a simple sentence be repeated? Is speech slurred or strange? time. During a stroke, every minute counts. If you observe any of these signs, call 1066 or your local emergency number immediately.
So we saw that stroke, the symptoms, and in the video we saw how fast can establish whether a person is having stroke or not. So just remember the small word fast, F for face, S for speech, A for arm drift. And if you ever feel that someone is experiencing this type of thing, again, time is very critical. He needs to go to the hospital as soon as possible so that it can be found out what type of stroke is it. Is it ischemic stroke or it is hemorrhagic stroke, and the treatment be started like that. Now, after this, we come to simpler forms of medical emergencies. We will just come back to broken bones with the thing, but we start with we have bleeding associated with broken bones. Many a times we have bleeding at home. It can be a cut from the knife or it can be a crushed injury. So types of bleeding. How many types of bleedings are there? There are three types of bleeding. One is called a capillary bleeding. The other one is a venous bleeding, and the third one is an arterial bleeding. To make it very simple, I explain you. An artery is a vessel which starts from the heart and it supplies oxygen and nutrition to the body. It has a high blood pressure. If it gets cut, the blood which flows out is very fast and it has a very big spurt. Venous vessels are the vessels which collect back the deoxygenated blood from the body to the heart. The blood pressure is low. So if a vein is cut, the blood will just flow out but not spurt. Capillaries are the small micro vessels which are present on our peripheries. Peripheries means below the wrist, on the fingers, on the hand, in the toes, in the fingers of the legs, on the surface of the skin. They are all capillary. So if we have a small cut, it might be just that the blood oozes a little bit and it stops of its own, or it can be just stopped by pressing it. So here in this diagram you see the first one is a artery cut. On the wrist, an artery has been cut and the blood is spurting out. The second one is a venous one. So if the vein is cut, it just flows down, but there is no spurt. And the blood color here in the venous one would be little less bright. It might be a little darker than the arterial one. The arterial one will be almost bright red. And the capillaries, as it's shown on the dorsal part of the hand, you see there's a scratch there and there's a little bit of oozing. So what do? We clean the wound with some antiseptic lotions which we have. You have at home, maybe you have Savlon, you have Betadine, or if you don't have anything, just clean it with a clean cloth, clean piece of bandage or clean piece of the wipes which you have. Just place a gauze onto it and cover it so that the blood flow stops. Next, we see here, you can see if there is too much of blood flow, you can just wash it under running water, put a bandage onto it, press it. You need to compress it so that there's a little bit of compression. Once there's compression, the blood itself starts to coagulate at the point where the cut has taken place, and there would be a clot there. Once the clot forms, the blood flow will automatically stop. There are other forms of managing big bleeds. Like if there is a big bleed which is just bleeding down, what we can do is we can tie the end a little away from the cut point so that we cut down the blood flow. So as you see in this diagram, number one, he has put the legs up on the stool. Why? It is just to bring down the pressure in the vessels. Once the pressure is down, the oozing will become lesser. Now we tie the hand because if we tie the hand, the blood flow will automatically be cut off and the bleed will stop. But a caution, we cannot tie the hands and feet or any part of the body like this for more than 4 to 5 minutes. If we do that, in the process of cutting the blood flow to only the blood cut, it will even cut the blood flow to the entire hand and the entire feet, which will have effect on the other parts of the hand and feet. So if we are putting a bandage so as to cut the blood flow, we can only do for a few minutes. So what do? If we have a gloves, we wear a glove, the exposed wound, cover it with a clean cloth, apply direct pressure. The first thing is to apply direct pressure. Elevate the area. If we elevate the area, we bring down the pressure to that place and the blood flow becomes lesser. Apply a pressure bandage. Wash with soap and water, flush with water, remove small objects, apply pressure to it. Apply medications if we have some ointment, antibiotic ointment like Savlon, Betadine. At home we can use Borolin, which is an antiseptic cream. We can use other forms of antiseptic creams which we use in household. We can cover the wound. Tetanus shot should be taken in all of these cuts by metal, cuts by falling on the ground, cuts when we fall on the road and it's very dirty. Tetanus shots should be taken every 6 months at least, because one tetanus shot can only prevents you from a tetanus for 6 months. So if 6 months, if you have not taken a tetanus shot, if the last tetanus shot, if you have taken it, it was 6 months prior to the episode, you will have to take a tetanus shot. So wounds that require medical attention, as I told you, these would be the wounds which don't stop by itself, that are the deep wounds. These would be basically the artery wounds which will spurt around and will need suturing. So these needs to be basically covered up, pressured, put a strap around the place where it's bleeding so that we cut the blood flow, take the patient to the hospital so that it can be sutured and taken care of. So dressings can be of many types. There are gauze pads, which are square shaped things which you get in the hospitals. There are compression bandage, which are basically absorbent materials. They are used for bigger bleeds. Avoid fluff cotton. At home we have fluff cotton only available, but if you have other types of gauze pads at home, please use the gauze pads, because these fluff cottons sometimes get contaminated with the wound. Sometimes it just gets stuck to the wound. So you can use any of these which is available at home, but if there is something else than cotton, better to use the other things. Can I request? So now, as you see in the picture, there's a bandage. It's just for description that there's a square bandage, there's a triangular bandage. These are things which are available in the market. At the end, I will give you a list of first aid things which you need to keep at home. So common bandaging method are the circular turns, the spiral turn, the spiral reverse. These are just the methods how you cover it up. The main idea is to clean the wound and cover it up by some type of clean bandage. So here we will show you the type of bandages which are sometimes used to cover the wounds through the video.
Bandaging is applied to create pressure over an area, to immobilize a part of the body and restrict its motion, to support and protect wound from contamination, to reduce bleeding or prevent edema, to secure a splint or dressing. Scalp injury. Forehead injury. Ear, cheek, jaw, injury. Shoulder injury. Chest injury. Arm, elbow injury. Wrist injury. Hand horizontal injury. Hand vertical injury. Ankle injury.
So as you saw in the video, that the elbow got injured. So while doing so, he was applied ice packs to get the swelling, to lower down the swelling, and then the triangular bandage was placed so that it supports the elbow, and then he is moved to the hospital. Next, very emergency at home or in office, many a time people just faint around. So what is fainting? Fainting is basically that may be due to lack of oxygen or lack of fluids to the brain, stops the brain for a moment, and the patient just feels giddy and falls down. What should we do in these type of things? Now, fainting should be actually understood in such way. A small fainting, or is something in which a person falls down and he regains his consciousness within a minute. This is fainting. If he falls down, loses consciousness, and he does not regain consciousness in a minute or two, is that he's become unconscious. We are looking at something which is fainting, which is within a minute he has regained his consciousness. What do we do then? We just try to place this person straight onto a bed or a couch. Just try to put his legs a little bit. What are we trying to achieve out of it? By doing this, we try to lower down the peripheral circulation in the body and give more circulation to the brain. In doing so, the brain gets more oxygen and it just restarts to work in a normal position. In this meantime, we can give fluids to the patient. We can give more of the salt water combination, which is known as the ORS, so that his body gets hydrated, the blood flow increases in the body, and so does the oxygen supply in the brain. So here you see that there is a sudden loss of consciousness. Causes can be anything. It can be from like standing in a hot humid weather. It can be sometimes the fright of the needles and the blood and the injection, or pain, unpleasant smell. So anything can lead to something like fainting, which is like less than 1 minute of losing consciousness. So doing this spontaneously, they sometimes regain their consciousness, and they should be laid down on a bed or a couch, as I told you, and given fluids to hydrate them. Do not allow the patient to sit, because if we make him sit, he might again have this dizziness and fall down and injure themselves more. So they should not be allowed to sit. They should only be laid down on some place, and till the time he feels better, he should be there on the couch or on the bed. Now we come to something called burns. This is also an everyday problem. It might happen anywhere, but to understand burns, there are a few things which we need to understand: the cause of burns, the types of burns. So a burn can be caused by fire, it can be caused by electricity, it can be caused by chemicals, and it can even be caused by cold climates. So there are difference in the causes of burns. So like there is a thermal burn, there is a fire burn, electricity burn, chemical burns. Okay, so how do we understand what's the severity of the burn? What has happened? See, a burn can be a superficial burn, can be a second degree burn, or it can be a very deep burn. How do we understand it? A superficial burn would only be a redness on the place of burn. The second degree burn, or which is a little deeper than the superficial one, would have some type of burning, it would have some type of bulla, it would have some type of eruptions there because of the heat which has affected the area. And the deep one would be exactly like something is burned black. To understand further, I would give you an example. At home, when we start making a chapati, we just put it on the tawa and heat it a little bit. It just reddens up. That is a simple type of burn. If you keep it a little bit more, it will have something like bullas. Bullas mean a little bit of entrapments of air, and you will see on the roti there are entrapments of air. That is when it is almost done. But you leave this chapati onto the tawa for another few minutes unattended, it will become burn and become black. That is the third degree burn. As is shown in the second picture, you see, the simple one is just the redness. The intermediary burn is something which has bullas all around. And the third one is charcoal black. So that's the deep burn. So what do we do when there is a burn? Now, with burn, there is an area which has been subjected to high temperatures. We need to put down the temperature. We need to lower down the temperature. The easiest way and the safest way is to put the affected area under normal temperature running water. It should not be ice cold, because as I told you in the starting, burns are caused by low temperatures also. Because of that, we need to just put that affected area under running water so that the temperature lowers down. We need to remove any type of tight jewelry, clothing on that area, because after the burn, the area starts to swell up. So it can further cause more entrapments of the vessels and the blood flow can be hampered. Cover the burn with clean, non-fluffy dressings. So if there is a burn, we need to just cover it with a cloth and take it to the hospital. So cool, clear and cover. These are the three things which you understand. Cool under tepid flowing water. Clear it with a cloth, or clear the jewelry, clear the things which have been there sticking to the burn. Clear any contamination of any chemicals which has just dropped onto the part where the burn has taken place, and cover it with a clean cloth. So what do we do? Do not apply any type of oil. Why? This oil will make it more moisturous and there will be lots of secretion there at the local site, and the chances of infection will be more. Do not apply ice. As I told you, if we apply ice onto it, it will further damage the circulation at that particular point. Due to burn, the circulation is already hampered. Due to the ice, the vessels will get constricted because of the temperature, and the circulation will get more hampered. If the circulation is hampered, the areas will die off very fast. Third, do not apply adhesive bandage. Adhesive bandage means the bandage which has glue to it, because if you put adhesive bandage to it, it will just peel off with the dead skin, and it might even further pull off the good skin also. Do not break the blisters. There's a common thing that there's a blister on the burn side. People feel it very unhealthy, but till the time the blisters are there, the skin is covered, the infection doesn't go inside. Once you break the blisters, the skin gets distorted and the infection goes inside. So please don't break the blisters. Leave it like that. It will settle out by its own. So the areas of the burn, if the burn is on the head, neck, eyes, they are very grievous burns. They should be taken care by the medical professional as soon as possible. The hands, feet and joints can wait. The groin is another important part which needs to be taken care of very soon, because these skin at these areas are very gentle. They are susceptible to burns. They cause deep burns at these places, and burns which are more than the size of your palm. If the burns are more than the size of palm, that needs medical attention very fast. So it's again the size of the burn, as I told you. A surface of more than a patient's palm size needs to be taken care in the hospital. The causes can be thermal, chemical, or electrical. The location, if it is on the face, the genital parts, that are more critical areas. The depth, if it is full thickness, deep burn, they are more serious patients. Now, chemical burns. Chemical burns can be caused by acids or maybe some type of sodas. They cause the same type of burns as a thermal burns. If you have a chemical burn, if something has just dropped on the body, the part needs to be cleaned by water. It needs to be covered by a fresh cloth and taken to the hospital for further management. Inhalation burns, a very important burn which gets neglected at times. If a person had just been in a site where there has been a smoke and fire, never mind he's not in fire, but the smoke itself has a high temperature. So if he has inhaled that hot gas, inhaled that hot fumes, these also causes burn in the airway. Means the nose, the lungs, they cause heat burns inside. And the same way as there is a swelling outside when there's a burn, there's a swelling inside when there's a burn. Because of that, they damage the airway and the lung. These people should be subjected to immediate treatment at the hospital so that the swelling can be taken care of and they breathe properly. Otherwise, they'll land up in having severe breathlessness, severe breathing difficulty, sometimes leading to choking and leading to death. So inhalation, as I told you, it will always need medical attention. There's a small video I'll just show you about the burn.
To distinguish a minor burn from a serious burn, the first step is to determine the extent of damage to body tissues. First-degree burn. The skin is usually red. There is swelling and pain in the affected area. Second-degree burn. Blisters develop in the affected area. Skin takes on an intensely reddened, splotchy appearance. There is severe pain and swelling. Third-degree burn. The most serious burns involve all layers of the skin and cause permanent tissue damage. First aid for minor burns, including first-degree burns and second-degree burns limited to an area no larger than 3 inches. Hold the burned area under cool running water for 10 to 15 minutes or until the pain subsides. If this is impractical, immerse the burn in cool water or cool it with cold compresses. Cooling the burn reduces swelling by conducting heat away from the skin. Don't put ice on the burn. Don't use fluffy cotton or other material that may get lint in the wound. Wrap the gauze loosely to avoid putting pressure on burnt skin. Bandaging keeps air off the burn, reduces pain and protects blistered skin. Third-degree burns. The most serious burns involve all layers of skin and cause permanent tissue damage. Call for medical help immediately. While waiting for help to arrive, Don't remove burnt clothing. However, do make sure the victim is no longer in contact with smoldering materials or exposed to smoke or heat. Don't immerse large, severe burns in cold water. Doing so could cause a drop in body temperature, a deterioration of blood pressure and circulation. Check for signs of circulation. If there is no breathing or other sign of circulation, begin CPR. Elevate the burnt body part or parts. Raise above heart level when possible. Cover the area of the burn. Use a cool, moist, sterile bandage, clean, moist cloth or moist cloth towels.
So as you saw in the video that it was a burn which is a simple burn. It was cleaned with normal water so that the temperature comes down, and it was covered by a clean bandage. The mainstay of treatment in burns is to prevent complication. People die of complication but not of burns. The infection which later on gets into the skin, gets into the body and creates problem. We need to cut off that. We need to try to prevent the complications and the infections. Electrocution, as you understand at home, it might be possible anywhere there's a leakage in the electrical points. Somebody just gets electrocuted. What happens when the patient gets electrocuted? Electrocution is a charge which flows through the body. It has effects, several types of effect. Number one which it has is the burn. The passage through which the electricity flows, it depends on the electrical energy. The more the energy, the chances of burns are more. So you would have seen that in the house, if you touch a wire which has a little bit of energy into it, like a telephone wire, it just has a uneasy, funny feeling which you get. If you ever touch a more higher volt of energy, it shocks you and hurts you. If there is someone who gets attached to a higher voltage, they might even die because of that high voltage. So at home, these small voltages don't have any problems, but the big voltages are problems. So what happens? It flows, if this electricity has flown through the heart, it might just alter the working of the heart. The heart works on a particular pattern. It has an energy within itself which tends to send electrical signals to the muscles of the heart, which makes the heart contract and release. If there is a high electrical energy flowing through the heart, it might just stop the heart, leading to death. It might alter the heart rate. It might even alter the electrical component. If there is someone who has a permanent pacemaker in the body, his pacemaker might stop. It might even burst out. The batteries can burst out. So there are lots of problems with electrocutions. So what are we looking at? Number one, we're looking at cardiac arrest, which happens after voltage, shock or lightning. There are burns. The area through which the electricity goes through, it burns the whole area. So it depends on the voltage. If the voltage is low, the burn is less. If the voltage is high, the burn, it gets charred away the whole area in which it has happened. Sometimes when the patient gets electrocuted, they are thrown out of the wire. The wire just throws it out. Once when the patient gets thrown, he might have other complications. He might have head injury, he might have bone injury. If he falls from a height, he might have the polytrauma type of picture. So there are complications attached to it when you have a high voltage electricity. Sometimes the arteries in the brains even tend to burst, causing stroke, hemorrhagic strokes in the body because of this electrocution. So what are we going to do? What do we do when there is someone who has got electrocuted? Number one, with electrocution, a person gets dehydrated. So we need to hydrate that person with lots of salt, lots of ORS, A person who gets electrocuted is the one whose potassium sometimes gets lowered, because our body functions on the salt balance in the body. So there are many salt like sodium, potassium, chloride, which has a system in the body which makes some charge, which delivers charge to the heart, which in turn has this pumping capacity going on. So once this electrocution takes place, the charge in the body gets disrupted. This positive and negative ions get disrupted. These happens because some of the salts just gets debilitated from the body. So the patient needs to be rehydrated. Rehydrated means he needs to get lots of salt, oral solutions, lots of sugar salt solutions to be given. He needs to lie down. He needs to be taken to the hospital to check for further complicated things which has happened, any type of injuries which has taken place, any burns which has taken place, any type of stroke which has taken place, and he needs to go to the hospital as soon as possible. So lastly, I would say that if there is a patient who has totally become unresponsive, then yes, we need to do CPR, which I think we had discussed earlier. This is how we try to resuscitate the heart and make it go further. Next come seizures. What is a seizure? Seizure is a term which is used for fits, which in normal terms you know as fits. What is a fit? It is a process of the body in which the brain stem, the brain nerves just start acting in a very chaotic way. To understand it, I'll tell you an example. If there is a electrical grid, or there is a electrical lots of electrical wires, and if any of the wire accidentally touches the other wire, there's a spark. It is the same way in the brain. The brain has lots of neurons, lots of nerves. It is just built up of nerves and neurons. When these neurons get touched in between by themselves accidentally or due to some diseases, fits occurs. Fits can happen in normal people who have a tendency of fitting, who have a tendency of epilepsy. Seizures can happen in patients who get low oxygen supply. They don't have any oxygen supply to the brain, such as when you have low sugars in the body. When there's low sugar in the body, the blood which reaches the brain does not have enough carbohydrates to give nutrition to the brain, and the brain just starts to work in a chaotic manner. If you have a stroke, the hemorrhagic stroke, as I told you, if there is a pool of water and you put two wires into it, it will spark. So in the same way, when there's a pool of blood in the brain, the wires get attached to each other and they spark. So these might lead to seizures. So seizures is a condition in which the brain is unable to control the body, and there are lots of uncontrolled activity, just as the hands start to move, the legs starts to move in a chaotic manner, the person becomes delirious, the person becomes unresponsive, and in all this jerking movement, due to all this jerking movement, there would be other injuries. There might be other injuries also, such as head injury. There might be other injuries to the other parts of the body. Sometimes the seizures are so severe that they can even lead to death. How are we going to treat this seizure? Number one, when the seizure is taking place, we cannot hold him because the person is chaotic. His brain is not working at that particular time. So just leave him till the time the seizures stops. Once the seizure stops, make him lie straight onto a straight couch or a bed. Try to support him, so try to support his head, try to support his other parts of the body, and try to find out why did he have his seizure. If you can help him by, if there are reasons such as low sugars in the body, you can try to give him sugars. If you think that it is because of the other diseases, you need to take him to a hospital for the thing. So it's like stay calm. Then you need to like move around objects around the patient, which might in fact hamper him. Maybe he can fall down onto that object, or the object can fall onto him and make the things more worse. You need to check out if he had some type of, he was on some type of medications which he has just left, so that we can give him medications at later on when he becomes a little better. So we'll show you a video just to see what we do and if we have seizures around us, if we have someone who has seizures around.
Relax. Don't panic, just move back.
Move any potentially harmful object out of harm's way to prevent injury. Do not restrain the person and give him or her head support. After the seizure ends, move the person onto the side. Tilt his or her head back to protect against choking from possible vomiting. How to give emergency medical aid to seizure patients. Move any potentially harmful objects out of harm's way to prevent injury. Do not restrain him or her from moving. Provide head support and wait for the attack to end. After the seizure attack eases, move the person onto the side and tilt his or her head back to prevent choking.
So as you saw in the video that the mainstay is to remove all harmful objects around the place where the person is having a fit. Just try to maintain his head by putting something under his so that doesn't bang his head on the any object or on the ground. And after the seizure ceases, you need to just make him lie on one of his sides. This is just to prevent either choking. As the brain is working in a chaotic manner, the body loses control of many of functions such as vomiting. The person can just vomit because he's not able to control his vomiting thing. He can even pass urine, he can even pass stool. So because of that, if he chokes because of the vomiting in a lying position, in a supine position, it's better that we move him on his side so that if he vomits, it gets out of the mouth, and rather not choke him so that he breathes properly. The next is choking. What is choking? Choking is something which gets trapped in our airway or in our food systems. So if somebody was trying to eat something and it has got lodged in his airway, he will have breathing problems, have choking feelings. If that person was eating something and it got lodged in his food, in his pipe, in the esophagus, through which the food goes into the stomach, it might even have this choking feeling. The worst one is the one which gets lodged in the airway, in the lungs. Because if something gets lodged in the lungs or in the trachea or in the airway, the person cannot breathe. If he does not breathe, the oxygen cannot reach the lungs, and if the lungs does not get oxygen, it would not be able to send that oxygen to the brain and create this whole vicious cycle of problems. So, how do we identify choking? So, if there is a choking, we just see the video. How do we go around?
Hello? What? Don't you understand deadlines? Your cutoff is tomorrow.
Ask if the person is choking.
Are you choking?
If the person is not able to speak, reach around the person's waist from behind. Make a fist and press your fist into the person's abdomen and give 5 quick upward thrusts.
Are you choking?
Ask if the person is choking. Reach around the person's waist from behind. Make a fist. Press your fist into the person's abdomen and give 5 quick upward thrusts. Repeat upward thrusts until the object is forced out. If the person becomes unconscious, he needs to be given basic life support immediately and taken to a doctor. A person chokes when the airway is partially or completely blocked. Unless given first aid, the person may die.
As we see that if a person was eating something and it got stuck in his throat, he has difficulty in speaking. This might be possible that it got lodged in his throat. And if we have something like this, if he has speaking difficulty, if he has breathing difficulty, if he has some type of pain in his throat, these are symptoms that there is something which is choking him in his throat. How can we help him? We can help him by doing abdominal thrust as shown in the video. We put our fist onto the abdomen and press it, try to press it. By doing so, we are increasing the pressure in the abdomen, in the stomach, which in fact tries to put pressure in the lungs, and it puts pressure onto the windpipe and the food pipe both together. So if it is lodged somewhere in the food pipe or in the windpipe, it just tends to come out. So next is something called heat exhaustion. During summers, during hot weather, people can have heat exhaustions, which is very commonly known as that a patient that the weather is too hot, it is very sweaty, it's very humid. What can happen? people can tend to have dehydration because of this heat exhaustion. Now, how do we help them out? For helping them out, we try to understand how serious is this heat stroke. Is it a normal one? Is it that the patient has become too dehydrated, or is it that is affecting the other parts of the body? So there's two types of heat stroke. It's not two types, it's basically a severity. One is a lesser severity, which is called heat exhaustion, in which the patient can be pale, his skin can be cold, clammy. This is because the patient is still sweating. So after the sweat, the body is cold after the sweat. He has a weak pulse because the body fluid is becoming less. He is having rapid breathing because of the low blood volume. The heart and the lungs tends to work more faster so as to get more blood to the brain, so as to get more oxygen to the brain. So in doing so, the heart beats faster and the person breathes faster to give more oxygen. Yes, profuse sweating because of the heat, the temperature, the the water in the blood just goes out of the body in the form of sweat. So he might still feel thirsty because there's low water content in the body. On the other hand, if it is too much of heating, so now there is no more water in the body to lower the temperature of the skin. So now it's becoming hot and dry skin. The pulse is very fast because the blood flow in the body tends to go around, send the blood too fast to the brain so that the oxygen can reach the brain. Since the blood volume is low, it has to overwork, and the heart needs to overwork, and hence the pulse rate increases. The patient is not sweating because there is no more water in the body which can become sweat and come outside. The patient can start having aggressive behavior because, as I told you earlier, the brain functions, the body functions on electrolyte system. The electrolytes in the body gets disturbed, all the systems of the body gets disturbed, the brain gets disturbed, and because of that there might be a aggressive behavior of the person. The person might just collapse because there is loss of water in the body. He might have seizures because of the electrolyte disbalance. He might just become unconscious because of the electrolyte disbalance. So whenever you have someone who has had heat exhaustion, heat stroke, replenish him with water. You need not give him cold water. Give him normal water, because with cold water he would not drink lots of water. With normal water he will drink too much. Please don't understand it that the patient would be given lots of soda water. Soda water is very harmful in these cases because here there's already a electrolyte imbalance in the body. When we are giving soda to the patient, the soda increases in the body and it tends to further damage the electrolyte system. It is better that we give plain water, normal water to the person and just try to lower down the temperature of his body, hence increase the volume of the blood in the body, and he tends to become better. Next is a common thing called nasal bleed. Anyone sitting in home, at office, might have a bleeding from the nose. Why does it happen? The few causes of nasal bleed are: number one, that somebody has picked his nose and due to the nail he has scratched his nostrils. The nostrils, as I told, it is a periphery of the body. It has lots of blood circulation, very minute vessels there, and a nail can even scratch and make the nostril bleed. The patient himself can bleed too much if he has a high blood pressure. In high blood pressure, these small vessels just spurt and the blood tends to flow down. There might be some type of growth in the nasal cavity itself, which due to some type of hypertension or some other tends to bleed. In any of these bleeding from the nose, what we need to do is to put local pressure onto the nose. So how do we put nasal pressure? You see in the diagram, you pinch the nose with 2 fingers on both sides and tend to keep it like that. During doing so, you need to breathe through the mouth. What are we achieving out of pressing the nostrils? We are achieving compressions. So when we compress the bleeding vessel, after a little while, when the blood clots, the vessel can just stop bleeding. We'll show you a video with this.
Do not panic and get a first aid box. Nosebleeds can be dramatic and frightening. Most nosebleeds are not serious and can be handled fairly easily. They are divided into 2 types, depending on whether the bleeding is coming from the anterior or posterior. Pinch your nose. Pinch the soft part of the nose with hand for approximately 10 minutes and breathe through the mouth. Squeeze the above nostrils firmly so that the bleeding stops. Check if the person has had an injury near his nose by slightly pressing the area around the nose. If the pain exceeds, contact a doctor immediately. If the bleeding continues for more than 10 minutes or bleeding is heavy, call the doctor immediately.
So as you see, you saw in the video, the thing which we can do when there's a nasal bleed is to make the person sit up and just pinch the nose for some time so that the blood clots and the bleeding stops. If at all, if the bleeding doesn't stop, never a problem. You just pinch the nose, let the patient breathe, take him in that position to the hospital so that there is no excessive bleeding and the doctors can take care of that bleed. There's something called allergy. Allergy is a very common thing which happens in household outside because people are allergic to many things. In fact, if we see around nowadays, people can be allergic to nuts, they can be allergic to food, they can be allergic to medications, they can even be allergic to some type of cosmetic items. So if there is an allergy, the symptoms of allergy is huge. The symptoms can start from a small urticaria, from a small rashes, from then there can be difficulty in like itching all over the place where there is an allergy. Sometimes there are redness all over the body, there is itching, there is breathing difficulty, and sometimes there is even complications like choking, even leading to death. So we need to understand these allergic reactions and as soon as possible and try to help that patient out. So if there is a severe allergic reaction, it might be that the person is having difficulty in breathing, or there's a noisy breathing, there's a swelling of the tongue, there's a swelling in the throat, there's a difficulty in talking, there's a persistent sound which is coming when the patient is breathing in and out. He might become dizzy, and the baby and the children can even become pale and floppy. So if there is something like this, we understand that it is allergic reactions. At home, we have many of the medications sometimes we have at home. In the last slide, I'll tell you the medication which will help you here. Okay, so if you have anything at home, call for help, lay the patient flat, loosen his clothing, make him breathe, give him, if there is vomiting or bleeding, just try to make the patient in such a position that he does not choke. If he's lying down, make him lie in a side position and not on his supine position. If there is a severe allergic reaction in patients who have asthma or breathing difficulty, they can use their inhalers, the Asthaline inhalers or whatever inhalers they have, so that this would decrease the severity, the swelling in the throat, and just easen up the problem. Bee stings, sometimes these bee stings, they have poisonous stings, so these can cause local erythema, local rashes at the point of bleed. So what we need to do is to, if there is any remaining sting in the part of the body, we need to remove it, and we need to get in touch with the hospital so that anti-inflammatory drugs can be used to remove the inflammation from the and the pain from the part of the body. Animal bites, there are many bites of many animals which are dangerous. The one most common is a dog bite. A dog bite can be from a dog which is a pet at home vaccinated, and can be from a stray dog. If there is a dog bite, the wound needs to be cleaned as soon as possible with a soap water. It needs to be wiped off with a clean cloth. Shouldn't be covered and brought to the hospital for further anti-rabies injections. The other animals which bites needs to be taken care of are the bats, the cats, and the monkeys. The bats and the monkeys, these bite would also require anti-rabies injections. The cat's scratches and the bites would require tetanus injections. So as I told you, they require tetanus injections because these animals, many of these animals carry tetanus germs in their claws and in their mouth because they are eating and they are moving all about the roads and the places where these germs are very active. A snake bite's a very uncommon thing, but it might happen in some areas where vegetations and growth are there. The mainstay of this is that if there is a snake bite, don't try to don't try to wash off the venom of the skin. Don't try to cut the bitten area. Don't try to suck the venom out of the wound, because if you cut the bitten area, the chance of external infection is more. If you try to suck out the venom, it might be possible that you ingest the venom yourself and get into problems. If you try to use a tourniquet, don't use a tourniquet, because if there is a snake bite, the venom has already traveled into the body through the bloodstream. It cannot be stopped by putting a tourniquet. But by putting a tourniquet, what we are stopping is stopping the total blood flow to that part of the body. So we are doing more harm by doing all this. Don't put any chemicals onto it. A snake bite should be taken to a hospital, and if anti-venom snake needs to be given, the injection is to be given as soon as possible to the person. So do not try to suck, as I told you, do not leave the wound intact, because if we harm the wound, the chances of infection will go through the skin and cause more problem. Don't put the tourniquet, as it would hamper the blood flow to the other parts of the body. Don't put cold compress and ice packs, because these would reduce circulation and would hamper the other functioning of the body. So it is that if there are not always a puncture, they should not be like they should not be, if there is no signs of puncture or bleeding or scratches, the symptoms may develop a little later. What are the symptoms that normally happens after a snake bite? These are headache, impaired vision, nausea, vomiting, diarrhea, breathing difficulty. In short, I can tell you the snake venom acts on the nervous system of the body. By doing so, the effects will happen on the things which are related to the nerves. The brain is related to the nerve, so it might have a headache. The vision is related to an optic nerve, so it might have an impaired vision. The vomiting is also controlled by the brain, by the nerves, so the person might have vomiting. So these are all things which are controlled by the brain, and at that point of time, the brain is unable to control all this. Intoxication is if a person has been under the influence of alcohol, it might lead to intoxication. Why does excessive alcohol create a problem? Because excessive alcohol would reduce the blood sugars in the body. It would have accumulation of harmful chemicals in the body. So if there is a person who has taken lots of alcohol, his blood sugar tends to drop. If the blood sugar tends to drop, as I have explained to you earlier, that once there is hypoglycemia, once there is less sugars in the body, the brain receives less sugars, and if the brain receives less sugars, the brain, the cells in the brain doesn't function properly, and it might lead to problems. So if there is a intoxication, if there is a person who has taken lots of alcohol, they can have slurred speech, they can have vomiting. To counter all this, we should rehydrate the patient with lots of water, so that and give him lots of carbohydrate sugars, so that his functions in the body doesn't become vary, and he is hydrated. If he is vomiting, he still would be dehydrated. So we need to give him lots of water, and we need to give him lots of sugars. So if he becomes unconscious, if he is having a weak and a rapid pulse, if he has widened pupils, these are all signs of intoxication, and that there is severe dehydration in the body, and there's severe loss of sugars in the body. So we need to rehydrate that person, and we need to take him to a hospital. Drowning. The last here is drowning, not a very common, but sometimes it happens that a person has just drowned. The mainstay of drowning is that if you find someone who has just drowned in water, he has been taken out of the water, the first thing that needs to be done is to assess whether the patient is breathing, whether the patient has a pulse or not. If the patient is breathing, has a pulse, he needs to be laid down in a side position, so that the water which will come out of his stomach, or if he is vomiting, it does not choke his airway. If he is not breathing, if he is not having any pulse, then obviously he needs to be performed a CPR onto him. But if the patient is just taken out of water, what we should not do is we should not put ourselves into danger by trying to go into water, or trying to if we are not capable of pulling him out of water. In the pictures next we'll show you. So if you think that the water is very deep, and if the patient is still drowning, you can just try to put a rope from a distance, so that he can just travel back to land. If you think that the water is shallow, you can just go into it and get him to hold something. But if you think that he has become unconscious, lay him lie straight on a flat surface, maybe on the ground, maybe on something, and try to get the water out of the body. Now, here there is a very common understanding of people that if someone is drowned, we need to press his abdomen and get the water out. I need to make you understand the water in the abdomen will not harm it, because on a normal day we all drink water and it all goes into the stomach. That doesn't harm us. The water which would harm him is the water which is in his chest. We need to remove water from his chest. So how do we remove that water from his chest? So by doing this abdominal compressions, what we are doing, we are again putting the pressure onto the abdomen more. That would intend put pressure onto the pleural cavity, and if there is any water into the chest, it will be brought out. It will be just pushed out. So by doing this, we are trying to clear the water in the chest and not the abdomen. Now, to summarize everything, all the first aid which I explained it to you, I would suggest you to have a first aid kit with you. I'll just shortly in the next slide let you know what is the content of the first aid kit. So the first aid kit should have, like, number one, a compressed bandage. It should have a adhesive tape. You should have a gloves with you. You can have a roller bandage with you. You can have gauze pad. You need to have triangular bandages, because you saw how useful is a triangular bandage to cover a part of the body. Any part of the body can be covered by a triangular bandage. The triangular bandage can support the hand, can support the legs in times when you need it. You need cotton foil. You need the crepe bandages. You can need the cold compressors. Nowadays in the market you have these gel-based cold compress and hot compress available. You can have thermometers with you so that you can know the temperatures if you need to know. Then in the case of medications, you need not have aspirin, because aspirin is something which is a blood thinner. So you just leave out this aspirin. The rest one is paracetamol. The paracetamol, which is Crocin, available in the market, is used for fever. It can be used for high temperatures, and it can even use for pain. If you have a body pain, you can use paracetamol. The next is Stemetil MD. What is MD? MD is a mouth dissolving tablet. Stemetil, it is very useful in dizziness. People sometimes have motion sickness. They travel in buses, they travel in cars, and they have motion sickness on the hills or on circular roads. Very useful, Stemetil MD, which takes off this dizziness and vomiting. You have tablet Voveron. This is used for high-grade fever and it is used for pain. You have Volini spray. This can be used for pain in a particular part of the body. Tablet Pantocid, it is an anti-acidic tablet, which if you have any acidity, you can use it. You can use Neosporin ointments for any type of cuts, betadine ointment for any type of cut, any type of boils. Digene syrup you can use for acidity. Normal saline, these are 100 ml saline bottles which can be used to clean cuts. It can be used to clean burns when you are not near to the hospital. You can use betadine lotions again to clean the cut or the bleed part of the body. You can even remove if someone has fallen and has a scald or a boil, it can be cleaned by betadine. Norfloxacin is an antibiotic which is normally used when you have abdominal infections in the form of maybe loose motions or vomiting. Emicet MD. MD is again a mouth dissolving tablet, is for vomiting. Stemetil and Emicet both are for vomiting. The idea behind mouth dissolving is that when you have vomiting, you take water, you tend to vomit out. These mouth dissolving tablets are to be taken without water. So it gets into your body, it acts and it lowers down the vomiting, still not using the water. The sorbitrate, as I told you, is very effective in chest pain and in pain, in other type of pain, in all type of cardiac pain. So if you have sorbitrate, you can use it every 5 to 10 minutes under the tongue. and it should help in cardiac pain. Tablet Avil is one which is anti-allergic in all type of allergies, rashes, itching, swelling after a thing which has caused the allergy. Avil should be fine with it. With this, I would request you to ask us any questions which you have, and I can just try to answer it as per your question.